Our first speaker today is Dr. Wyatt Decker. He's the CEO of Mayo Clinic, Arizona. Dr. Decker is an emergency medicine physician by training, has been with us here in Arizona for, I think, the greater part of 8 years now. Without further ado, Dr. Decker.
Well, thank you, Dr. Bryce. On behalf of all of us at the Mayo Clinic, welcome. It's great to see all of you here with us today. Some of you have had a journey with us. Some of you are here to learn more about both the Mayo Clinic and living with and overcoming your or a loved one's cancer, and we welcome all of you. It's interesting for me to take a step back and maybe share with you some reflections on the Mayo Clinic, established over 150 years ago, really in the cornfields of rural Minnesota. Today we are the global authority on health care, and we take care of over 1.4 million patients each year at the Mayo Clinic from over 140 countries and, of course, every state in the Union. Here in Arizona, we've been practicing for over 30 years, and we have continued to grow. But our growth and our focus at the Mayo Clinic is not random, and it's not happenstance. It's really about a single primary value that we place the needs of our patient first. Everything we do as a not-for-profit physician-led organization, everything we do is designed to enhance the care, the teamwork that we provide, the technology that's available for our patients. The reason we exist is to serve our patients. And that for us is a very powerful guiding star in everything we do. So today at Mayo Clinic in Arizona, after 30 years, you'll be learning a lot about what we offer or what we are planning to offer in the future in cancer care, which is incredibly exciting. You'll hear about our proton beam facility, one of the world's most sophisticated proton beam treatment particles. It's a type of radiation therapy that pinpoints cancer deep inside the body if we can't remove it. You will hear about cutting-edge clinical treatments that are only offered at Mayo or places like Mayo, centers that are studying next-generation treatments. But that actually isn't, if you were to say, what is it about the Mayo Clinic that makes the Mayo Clinic special? We have amazing technology, and we have an incredible history. But more than that, it's the team that comes together around the patient. You'll hear from many of fantastic experts that have had their careers inside the Mayo Clinic and have become world experts in their domains. But it isn't even the individual experts that distinguishes Mayo. Truth be told, there's many centers of excellence around the country that have world experts in cancer care and other areas. So there's two things about the Mayo Clinic that I think are truly unique, and one is the teamwork, that both the team that you see as a patient at the Mayo Clinic and the team that is behind the team that you may not see so much of. So you may not know that there is a vast infrastructure that we put in place to assure the best possible care, and I'm going to share with you a couple of examples of that. We have a safety and quality team that is constantly analyzing data and determining where are we doing well and where could we do better. And some of you are aware of this, but there's countless organizations, the government, insurers, not-for-profits that like to monitor and rate healthcare organizations. We're very proud of our results. They are the best in the United States. However, that is not what drives us. We are not studying for their tests. We invest in quality and safety because we believe it's the best thing for our patients. So you'll find many practices at the Mayo Clinic that we've developed simply because we think it allows us to give better patient care and better outcomes. So what does this lead to? Well, let me share with you. Today, the Mayo Clinic Hospital here in Arizona is the #1 safest teaching hospital in the United States, not in the state of Arizona, in the United States. Incredible, right? Safest hospital. What does that mean? That means that every year about 240 patients leave the hospital here that in what would be a typical or an average teaching hospital would not have made it out. So the data tells one side of the story, but but your and others' personal journey tell the most important side of the story. So even though we're very data-driven and we look behind the scenes and we build these teams that some of whom you don't even meet when you're a patient to create the safest care in the United States, that's not the most important thing. The most important thing is you. And when you come to us, your unique needs and your unique perspectives are really, really important to us. And so the other piece of the Mayo Clinic is taking care of the whole patient. And that's really, when you look at the agenda of the conference, that's what this conference is all about. We've come to recognize that we want to give you a new forum other than meeting with your physicians and nurses and physical therapists personally, which is quite crucial. We want you to also have the opportunity to come to a forum like this, hear from other experts, hear about nutrition, hear about other patients' journeys, and through that, learn more about your own journey or your loved one's journey with cancer. I also wanted to share with you what happens when a global organization like the Mayo Clinic focuses not only on meeting the needs of our individual patients today, but when we're thinking about how do we do a better job meeting them in the future. So here at Mayo Clinic in Arizona and for Mayo Clinic nationally, we've launched centers that are designing solutions for patients' care that we don't have today. How do we meet the unmet needs of patients? We have teams that are working in an area called regenerative medicine and tissue engineering, where we can take tissue out of an adult human body and re-engineer it in a lab, grow it for any tissue that the body might need, heart, lung, potentially even neurons down the road, and then reimplant it in the human body. We have a lab here in Arizona that is doing this work, as well as Rochester and Jacksonville, Florida. We have a team of scientists that are looking at the big data of healthcare, looking at over 40 million patient journeys, de-identified so that we don't learn anything about any individual patient, but we look at over 40 million patients and we look for trends in what can treat them best in cancer and in other conditions. So we have a whole team in the science of healthcare delivery of the Kern Center looking at how we can deliver care that's higher quality at a lower cost with the best outcomes possible. And then we have a team that's working on the power of genomics and other omics. How do we unleash the power of genetics to understand cancer care and other conditions more completely and more effectively? And again, you'll hear about much of that today, but incredibly exciting work. Finally, we believe that it is our obligation to help create the medical care workforce of the future. And here in Arizona this year, we're incredibly proud to have opened a new campus for the Mayo Clinic School of Medicine. So we have a 4-year medical school that has its first class of students, 50 medical students. And in addition to learning the science and the art of medicine that we would all want them to learn, we're also teaching them the Mayo Clinic model of care, because we want to make sure that there are generations of physicians that understand the importance not of themselves, but of serving others, of serving their patients, of working in teams, and then and we're even embedding into their curriculum in a collaboration with Arizona State University, engineering principles of how to measure and improve the healthcare system that they're part of. So it's been a tremendous journey launching our medical school. And again, medical school, impressive cutting-edge scientific endeavors, really exciting new technologies that you'll be hearing about. All of those are really exciting in and of themselves, but they're not the whole story. The whole story is how they fit in to our relentless desire to do the best job we possibly can, taking care and serving each of our patients at the Mayo Clinic. So as you go through the rest of the day today, I encourage you, as Dr. Bryce did, to ask questions, to probe, to learn, and then also reflect on this organization, that everything you hear and do circles back to this one principle: how do we do an even better job taking care of you tomorrow than we do today? Thank you very much, and I hope you have a wonderful day. Thank you. Dr. Bryce.